There wasn't proper testing. They just went by basic symptoms. People were definitely paranoid. Is it safe to go out? Can we do this? Is it in our food? Is it here or is it there?
You may think Sacramento City historian Marcia Iman is talking about the current COVID-19 pandemic, but in actuality, she's discussing something that happened over 100 years ago.
So most people aren't aware of this, but this actually isn't the first time that we've seen a pandemic here.
We have seen different epidemics, but really there's only been one other. The last time that we had a pandemic reach the scale was in 1918.
That pandemic was the Spanish flu, and 102 years ago it overtook society, much like the coronavirus is now. And despite a century passing since then, the similarities are eerie.
You know, in 1918 they considered this what is called a crowd disease. They understood that it was a big cause of this was when there were large groups of people together.
Sacramento County public health leaders are saying
that we direct a statewide order for people to stay at home.
It was called the Spanish flu. It was called the Spanish flu because it didn't originate in Spain, but Spain had the highest amount of cases of it, and so it just took on the name.
Why do you keep calling this the Chinese virus?
It comes from China. That's why.
They closed movie theaters, churches, but they didn't close the saloons, which was really ironic.
We are directing that all bars, nightclubs, wineries, brew pubs, and the like be closed in the state of California.
We did make it mandatory here in Sacramento to wear a mask.
Officials are now asking everyone to cover their faces on top of keeping safe distance.
November, our election is taking place. They want people to participate, and I had these photographs at one where they're showing the guy, and they said, if you wear your mask, vote. And they were pushing people to go out and vote.
Amid this pandemic here at home, several presidential primaries have been rescheduled, but Wisconsin went ahead today with voting.
There wasn't proper testing to say, oh yeah, you have the Spanish flu. They just went by basic symptoms.
Because there's still nowhere near enough testing available to know what's really happening.
The first case of the Spanish flu came to California in September of 1918. Part of the spread was due to large gatherings at World War I wartime parades.
And I published it in the paper that you would be a slacker if you didn't turn out for this event. We know that 1,500 people were in the parade and over 3,000 people came and lined the streets to participate in that. Directly after that, we see a rise in the increase of illness.
The Spanish flu was incredibly deadly.
And we have the death records for everyone buried in the old city cemetery.
But it wasn't just California that was hard hit.
Somewhere between 40 to 100 million people died globally. In the United States, there's about 675,000 deaths, which is more deaths not only than in World War I, but in 20th century wars for the U.S.
During the 1918, it was the large, very urban populated areas like New York. Again, New York was hit really hard by this. San Francisco was hit hard. LA. You can kind of see that pattern again.
With few resources compared to today,
there was no television, and so there was no internet. There was no forms of communication.
Connection and communication were a means of survival.
They were totally dependent on what the newspaper printed and whether they could get a newspaper at that time. So there were a lot of people, especially poor people, who were at home, and they had no way to really communicate out. The similarity is that they have recommended to people, know your neighbors, check on them, call your friends, stay in contact with people, and if you don't see a neighbor for a little while, maybe you ought to check to make sure they're okay.
Showing that no matter what year it is, people will step up to care for one another.
They called it an art house, but women were all dancers. I'm assuming they took off layers of their clothing at different times.
No matter their background.
They were the ones that volunteered to go into the homes and take care of people.
These women were the ones to step up, something they were able to do because of their caring hearts and empty calendars. The pandemic caused their source of income to shut down, something that many of us can understand today. But according to Sacramento State Professor of Economics, Casey Chalmers, we currently are in a place closer to the Great Depression than the Spanish flu pandemic.
And our economy has changed so much in the 100 years since 1918. Economically speaking, the lessons from the past that are probably the most prescient are from the Great Depression, to be perfectly honest. But the Great Depression wasn't as sudden as this has been. I think in terms of like the unemployment numbers, the comparisons are spot on. I mean, I would not be surprised to see unemployment rates be north of 20% easily in the next month or so.
Like those who lived through the Great Depression, she believes this will impact our generation's habits.
People who survived the Great Depression tend to be much more cautious about their spending. They tend to be much more in the saver mentality. My in-laws, who were 84 and 87, always had at least 3 weeks of food on hand in the pantry because you never knew, when things weren't going to be in stores. I think we're going to see a change in people's attitudes, or it wouldn't surprise me.
In comparison, one of the biggest differences from today's pandemic was how hard-hitting it was on younger people.
I don't think that the labor supply is going to be as affected as it could be.
Chalmers says since those who are younger and still in the workforce aren't as at high of a risk from COVID-19, it's a silver lining for the hopeful recovery of our economy.
If you look at the AIDS epidemic in sub-Saharan Africa, or you look at the Ebola epidemic in Western Africa, part of what made the economic recoveries there so hard is because you lost a large proportion of the working age population. So even if you wanted to get back to work, it was hard to find people to fill those jobs.
AIDS and Ebola are two diseases we can recall within our lifetime, but for many, especially in the United States, they didn't directly impact us. That's why for many, our quiet world of social distancing and sheltering in place is a new and odd normal, but not for all.
Hi there. How are you?
Good, how are you?
I'm fine, and you're Andy. I'm Bets.
This is the second time 88-year-old Bets Riolo has had to quarantine in her lifetime.
I had to quarantine when I was 9 years old.
She remembers living in Sacramento when there was a scarlet fever outbreak.
And then my mom got very sick, and they quarantined us in the house.
As her father stayed with friends to continue working, she quarantined with her mother and brother in their house located on 34th and L in East Sacramento.
When Dad would come and put stuff on our front porch, we would just wave to him and throw kisses. I had to do my home. They sent books home that could be destroyed because they were worried about germs. It weren't viruses then, it was a germ. It's a different point of view when you're an adult than when you're a child.
The memory of her first quarantine was a fond one.
It was a time that I remember as a very, very special time because my mom always worked and we had her alone for 3 weeks. And when she was feeling better, she would play games with us and we would have tea with my dishes that I had and listen to Little Orphan Annie and the Lone Ranger on the radio. We had a tea party every afternoon. So I would think that for today's parents that are having this problem at home, their kids may be enjoying it more than you think they are.
But her second shelter in place is much different.
I live in a senior community. They bring our meals to our rooms because they don't want us to get out. We're the vulnerable population, being the elderly. And somebody told us it was a golden age, and I think they lied.
And is it lonely, or is it concerning, or is it just kind of this is the way it is right now?
It's lonely, but that's part of old age too.
And despite a lifetime passing in between the two, there are certain things she sees that remain unchanged.
I know that at my school, they would check the class every morning before school to check if they had a fever, and one person got it.
According to Johns Hopkins medical historian Graham Mooney, measures like these helped implement what is being done today to prevent the spread of COVID-19.
Scarlet Fever was actually very important for the development of the kinds of measures that we're seeing in the present day with COVID-19. Scarlet fever was one of the diseases that isolation hospitals were set up to manage in the late 19th and early 20th centuries. And they'd only be able to be visited through what were called window appointments.
But treatments aren't the only aspect that carries on from past pandemics. There's a likeness for minority groups.
One of the things that epidemics and pandemics like this do is they kind of expose the problems that are already present in society.
African American communities, immigrant communities, poor communities, ability to access healthcare, that's another similarity.
This pandemic seems to be exposing the cracks in our public healthcare system that have always sort of been there, but have been easy to sort of gloss over or ignore. When you look at the infection rates for African Americans and the Hispanic populations and how much higher they are, I mean, part of that is because they're in jobs that are considered essential, but part of it too is they deal with more stress and they're more likely to have underlying health conditions and they're less likely to have access to care.
And yet, despite so many parallels, the devastation of past pandemics has been all but forgotten.
It was really dramatic figures, but ironically, nobody talks about it very much. And if you look at, like, when we turned for the new century in 2000, like, they all talked about World War I, World War II, Vietnam. They only talked about wars, and they totally left this out.
Historians want us to remember in particular the Spanish flu, as it is one of the most closest experiences we've encountered to today. So how did they recover from it, especially as vaccines did not exist 100 years ago?
There wasn't one move that could be seen as the end of influenza. And so that's perhaps why it's also been a bit forgotten, that we can't attribute to a single person, a single medical discovery, one single moment at the end.
But when things started getting better, a combination of relaxed rules and soldiers returning from World War I sparked another surgence of the Spanish flu.
The incidences went down and they relaxed it. Come January, there was a resurgence in it, and then they made them start, they argued back and forth about it, but then they finally reinstated the mask rule.
One of the things about the 1918 flu is that it actually came in 3 waves, and the second wave was actually the most lethal. So the first wave came through and sort of abated, and everyone thought, phew, it's over. And then it popped back up again because we sort of returned to normal too quickly. And then the second wave was even more deadly than the first. And then there was a third wave that was not as deadly as the second, but even more deadly than the first. We can definitely, Governor Newsom was talking about how it's not a light switch, but a dimmer.
And it seems that ultimately over the course of these 3 waves in 1918 and 1919, that there did develop herd immunity. There was no longer a population for the influenza virus to circulate in and harm.
After multiple waves of the Spanish flu, eventually, and with caution, society opened back up. But things didn't go back to normal right away.
The Bee had a basketball league, and they said the basketball league could go on because it helped morale of the community. People in the audience had to wear masks, but the players didn't. The minute they stepped off the court, they had to put a mask on. Same thing with baseball players, any kind of sports.
Helping create new measures locally.
Sacramento was the first city in the United States where the medical organization formed as a group and started documenting and tracking diseases in the area. And so we have really good documentation, probably better than most cities in the United States.
Despite the Spanish flu eventually disseminating, it continued to impact the political landscape for years to come.
But I think it is telling that when Warren Harding ran and won, he ran on a platform of a return to normalcy.
That's really interesting. Was that his actual slogan, a return to normalcy?
It was.
I'm not going anywhere.
Nevertheless, I do think we can learn from the 1920 election. The desire for what people perceive as normalcy absolutely can affect choices in the voting booth, and I think has at least influenced some of the current takes on, if not the 2020 election yet, then the Democratic primary.
There's a quote from poet and philosopher George Santayana. Those who do not remember the past are condemned to repeat it. So what's the biggest lesson from the one and only pandemic like ours before?
I mean, history in so many ways is about cycles and patterns, but it's also about understanding change over time, context, and contingencies. And I think that last part, contingencies, is really important in both drawing comparisons to the past, but also being careful about how we draw those comparisons, because 2020 is not the same as 1918 or 1920. I think one of the big lessons from that is that transparency does matter.
We need some straight talk, and we need to tell people the truth. We need to bend the curve in the state of California.
It's why you need transparency, and it's why politicians need to be able to be they're the ones who are making the decisions on our behalf about where resources go and when it's going to be okay to go back to school, go back to work and so on. It's why they need to be open to scrutiny as much as possible.
As for our roaring 20s, once we're past this pandemic, there may be play in store.
It seemed, as the United States moved into the 1920s, the Jazz Age was in certain ways an era of fun and play and forgetting of both influenza and war. And so I think that also perhaps tells us something, psychologically about how we operate.
For now, despite these frightening times,
why not help my community in some way?
We can look back as a means of faith.
It feels good to be able to give back.
That we will get through this.
I want to make you be happy.
Despite the uncertainty of our own recovery.